Okay, the last section is health externalities. Question 46. Consider the market for flu vaccines. Which of the following best describes the herd immunity positive externality of vaccination? So, a positive externality is when you take an action that has benefits above and beyond yourself. So, it benefits you, but it also benefits other people that are not part of that market transaction. And so, in this case of the options that are given, the answer is going to be D. The positive externality is the difference between the social and private benefits of vaccination. So, the private benefits of vaccination is going to be the benefit to you of not contracting that disease. The social benefit is your private benefit plus the benefit that other people get from you being vaccinated and therefore unlikely to contract the disease and infect other people. So, that difference is going to be the positive externality between those two. If we go through the other options, when the case of a positive externality, the free market outcome yields an inefficiently low level of vaccinations. We would want more people to get vaccinated because of the social benefit. B, the positive externality is the vertical distance between the social and private demand curves, not the social and private supply curves. And then C, assuming a perfectly elastic supply curve, the socially optimal equilibrium yields a higher price for vaccines than the private equilibrium, blah, blah, blah. In the case of a positive externality, because the difference is in demand curves, and we assume perfectly elastic supply, what that means is that the price is exactly the same. It's simply the quantity that's going to be different. The socially optimal quantity is larger than the privately optimal quantity. Now, suppose we didn't have a perfectly competitive market and we didn't have a perfectly elastic supply curve, but we did have a traditional upward sloping supply curve. Then in that case, then the optimal price would actually be higher. Um, but given what the question is saying, assuming a perfectly elastic supply curve equal, meaning a horizontal supply curve, that means that the price is fixed at the basically market clearing zero profit price because it's perfect competition. So an increase in demand from private to social demand just increases quantity, doesn't have an impact on price. All right, 47. Which of the following best describes negative externality from taking antibiotics? So if you take antibiotics, that's good for you because you're less likely to get a bacterial infection, but it's bad for other people because as you take antibiotics, then what ends up happening essentially is the antibiotics are going to kill off all the bacteria that are susceptible to the antibiotic. But then there's always going to be some bacterial mutations, just random mutations that happen. And the bacteria that don't get killed by your antibiotics are the ones that are naturally resistant to that strain of antibiotics. And as more and more and more people take antibiotics, then essentially through natural selection, or induced selection in this case, then those bacteria that are resistant to antibiotics are going to be the ones that breed, that grow new bacteria, and new strains of antibiotic resistant bacteria are going to be more likely to come about. Now, this is a negative externality because we're going to have to come up with a new antibiotic that is effective at treating these new strains of bacteria. That takes time, that takes cost, that's money. And it's just an ever and never ending cycle where you have to keep on coming up with new kinds of antibiotics to effectively treat the bacteria that become resistant to the existing types. Okay, so the answer here is going to be D essentially, is that as you take antibiotics, you get a benefit, but you're imposing a cost on society. Okay. 48. In the case of vaccinations, which best describes the inefficiency of the free market outcome? And so the answer here is going to be that there's an inefficiently low quantity of vaccines consumed because people aren't necessarily factoring in the social benefit of vaccination when making their decisions. I'm sure there are probably some super altruistic people that do, but the vast majority of people, when they're deciding, should I get vaccinated or not, their decision is basically, I want to get vaccinated so I don't get sick. All right, so let's go through the other options that are here. Since there are a limited number of vaccines available, your consumption imposes a cost on others. While that may be true, that's certainly not an inefficiency of the free market outcome. That's basically just, the distribution of vaccines. That's the market efficiently distributing vaccines to those who are willing to pay for them, which effectively could also be considered those who need them the most. Uh, B, the market price of a vaccine is inefficiently high as it does not reflect the true benefit of a vaccine. No, if anything, again, if it's a perfectly competitive market, then the price is going to be the same, and the free market and the socially optimal outcome And even in the case of a non-competitive market, as demand goes up, which it does when it goes from private to social demand, then the price would go up. So if anything, the price of a vaccine is inefficiently low. And then D, there is indeed an inefficiency in the market because we have too few vaccines coming out because we're not capturing the true total benefit of a vaccine when people are making decisions based off of their own benefits and costs. Now, it may be true that the government doesn't do a great job of reaching the socially optimal outcome, but it's not true that free markets always do a better job than the government. And there are certainly lots of cases where the free market does lead to an inefficient outcome, and well-tailored government policy can lead to a better outcome. Okay. 49. Unnecessary trips to the emergency room, for example, going when you just feel nauseous, represent a negative externality in that they do take away needed capacity from those in dire need of an emergency. People that need to go to the hospital where time is of the essence, somebody who's having a heart attack, somebody who just got into a car accident. And so let's think about, what are the ways that we could effectively reduce this action which generates a negative externality? And so the answer is all of the above, basically A, B, and C, all could potentially work. So the government could impose a Pigouvian tax if you go to the emergency room and it turns out that you didn't really need to go. Maybe you could get some kind of like financial penalty imposed on you. Now, this might not seem fair. People don't really know when they need to go or when they don't. But maybe you'll spend a little bit more time thinking, do I really need to go to the emergency room, for this? Maybe I'll just call up, the doctor, see what they think rather than just go there because, let's say that you've got really good insurance that covers the cost, right? B, those in need of emergency care are able to costlessly coordinate and pay people to stay away from the emergency room in non-emergency situations, assuming, of course, this is feasible. So this is a cozy and bargaining solution. If there is zero coordination cost and we're able to actually enforce such a thing, then this could feasibly be an effective policy, right? Is all the people that are on the verge of a heart attack could somehow pay people that are just going to the emergency room because they got a boo-boo on their thumb. Potentially that could work, right? I mean, probably this would be almost impossible to implement in practice, but if we do assume such a thing is feasible, then that could solve the market failure. And then C is you just have the hospitals basically create a virtual doctor's office that people can instantly connect to for a free consultation. And so this is sort of a quasi-cozy and bargaining solution where the hospital is essentially paying people that don't need to come to the emergency room to not do so. Now, they're not paying them directly in terms of a cash payment, but they are paying them in terms of the service that they're providing, this virtual doctor's office that has an instant connection. And so this is essentially the hospital making a Cozian solution that was suggested in B actually a much more feasible and implementable thing. So all of these could be effective at reducing the negative externality. 50. Suppose that the total cost of a Pigouvian subsidy for vaccines exceeds the social loss that this subsidy eliminates. So basically, what this means is the government is paying like $1 million to lower the price of a vaccine, and in so doing, they were able to eliminate the social welfare loss of inefficiently low vaccines that was in the total of, let's say, $200 million or $200,000. So basically, they're paying more in the subsidy than the social gain of that subsidy. It turns out that this does not mean that the subsidy is inefficient because that $1 million subsidy payment is a transfer from government to consumers. The consumers now have this money. They pay less for their vaccines. And so we don't want to just pretend like that doesn't provide a benefit. Those consumers are now gaining more surplus because they're not paying as much. And so the net social benefit is still that positive gain in an increase in vaccines. We're simply having a transfer that goes from the government to consumers. Now, the only possible situation where you could say that this was not efficient is if, to pay for that subsidy, the government raised taxes to the point where they led to such distortions that the net social, or sort of the net cost of this, when you're thinking about sort of the general equilibrium effects and all the markets together, the net effect of raising taxes far exceeds the value of the subsidy and the value of the social welfare gain. Possible, but you'd have to make that statement and make that claim, which is not part of these. Alternatively, maybe the government goes into a huge amount of debt to pay for this subsidy. That debt, ends up jacking up interest rates, ends up crowding out private investment. In the long run, costs are really big. Again, that could potentially be a reason why you wouldn't want to have a subsidy, but you need to specify that that could be the case. All right. 51. Which of the following describes the conditions that need to be present for a closed bargaining solution that can achieve a socially efficient market outcome in the presence of externalities? So you need three things basically, but two things that are defined here. You need strongly defined property rights and low transactions costs. The third thing is basically you need to be able to enforce the sort of bargaining solution. You need contract enforcement. A lot of people just sort of lump that in with transactions costs. So strongly defined property rights, low transactions costs, which is inclusive of contract enforcement costs. Okay. 52. Suppose that organ sales were legalized. In other words, people can sell their organs at a price above zero. Which of the following is most likely to occur? So let's go through each of these. So A, there'll be an unambiguous increase in overall health as the number of people waiting for organ transplants declines. So while it's true that probably there will be fewer people waiting for an organ transplant because the quantity supplied should go up, the quantity demanded should go down as the price of an organ goes up, it's not really necessarily sure that there's an unambiguous increase in health. So even though you have more people that need organ transplants getting them, you may also have a lot more people that, for example, are selling their kidneys. And, when people are living with one kidney as opposed to two, they're less healthy. There's a lot of health risks that go along with that. We might also have a situation where more people are getting transplants, but the people that are getting transplants are generally the richest people on that transplant waiting list, not necessarily the people that are most in need of one. And we might have a situation where a bunch of very wealthy people get more transplants than the situation before, where it was purely a donation thing, where there's fewer transplants, but those transplants go to the people where they did the most good. And that might also mean that health is not necessarily unambiguously increasing. Okay. C, the number of people waiting for an organ transplant will increase as the price reaches the point of not being affordable. Again, we certainly should expect that if you could sell your organs, the number of people waiting for an organ transplant will go down. Certainly, the quantity of organs being supplied will go up. And it's quite likely that the number of people demanding organs will go down as the price also rises. Okay, so we should see a decrease in the number of people on the transplant waiting list. And then C, the quantity demanded of organs will increase. Almost certainly no. And whenever the price of something goes up, we almost always see the quantity demanded go down. So the only one of these that's likely to occur is B, health inequality is likely to increase as wealthier people get organ transplants before poorer people. And then the last multiple choice question, for which of the following reasons would a Pigouvian tax on organ sales work more effectively than a closed bargaining solution, assuming that society deems such sales to be morally repugnant? Basically, the idea here is that, let's say, millions of people find these organ sales to be morally repugnant, and the individual, sort of negative externality that's imposed by people selling organs is like, I don't know, $1, right? You could try to organize all of those people together, right? And you would end up with a lot of money that you could potentially have to deter people from selling their organs. But how would you collectivize that action, right? You would spend way more money than the total value of the negative externality just to collectivize that action. And so rather than try to come up with a decentralized solution amongst millions of people who each individually have a huge free riding incentive, because if the solution is there, they benefit whether they paid for it or not, it's likely that a much more effective mechanism would just be to have the government act as a single entity on behalf of all these other people and just impose a tax on organ sales. And in the case of, sort of what exists in every single country but Iran, basically an infinite Pigouvian tax that completely makes organ sales illegal. Okay, so that is the end of the sections in the multiple choice section. So exam Monday, you can start at any time between 10 a.m. and 5 p.m. Pacific time. You have 2 hours to take it, so don't start any later than 3 if you want the full time. I'll have the Zoom window open during much of that time. I also strongly encourage you, if you can't reach me, send me an email. I'm happy to help you. If any problems come up at any point during the exam, reach out to me immediately. I can fix stuff if you tell me about it when it happens. I can't do it if you tell me about it like 5 hours afterwards. So anyways, good luck. Should be a pretty straightforward thing. It's about the same length as exam number 2. So multiple choice, short answer. A couple questions where you're going to have to sort of photograph your graph and upload it, but it's written to be an hour and 15-minute test. So you have 2 hours to finish it. You should have plenty of time for everything. That being said, you want to budget your time wisely. Maybe do the short answer first, and then go to the multiple choice. Uh, Otherwise, yeah, good luck.